You're not imagining it. That quiet discomfort. The dryness that feels like sandpaper, the sting when you sit, or the way intimacy has quietly turned from something you look forward to into something you avoid. According to a 2021 study in the Journal of Women's Health, nearly 6 in 10 women after menopause experience vaginal dryness or pain, and more than a third say it affects their confidence, relationships, and joy. But here's what most women never hear. This isn't just aging. It's biology asking for balance. And there's a gentle, evidence-based way to bring that balance back. A therapy so small it fits in your hand, yet so powerful it can transform how you feel. It's called Vaginal Estrogen Cream. This isn't about turning back time. It's about coming home to yourself soft, strong, and whole again. Estrogen isn't just a hormone. It's the quiet architect of your body's most intimate systems. It keeps tissue flexible, it fuels blood flow, it maintains moisture, and it protects the balance of good bacteria that keep infections away. When estrogen begins to fade, usually in your 40s and 50s, these systems start to whisper for help. The vaginal walls thin. The natural moisture that once arrived without thought begins to disappear. Even your pH shifts, allowing irritation and infection to move in where balance once lived. At first, it's subtle. A bit of dryness, a bit of burning, but over time, you might start avoiding things that used to make you feel alive. And that slow retreat can feel lonely. Doctors call it genitourinary syndrome of menopause, or GSM, but it's more than a diagnosis. It's your body's way of saying, I miss the rhythm we used to have. The moment you start listening to your body, healing begins. What makes vaginal estrogen so remarkable is how precisely it works. Your vaginal tissue isn't dead after menopause, it's simply waiting for a signal. When you apply a low dose of estrogen locally, it travels just a few millimeters deep, awakening tiny receptors that have been sleeping. Almost instantly, your body remembers what to do. Blood flow increases. The tissue begins to plump again, drawing in oxygen and nutrients. New cells grow, collagen rebuilds, and the skin becomes soft, supple, alive. Even the bacteria that protect you, the lactobacillus that keeps your pH healthy, begin to thrive again. Within 2 to 4 weeks, most women say they feel comfortable again. By 6 to 8 weeks, intimacy feels like connection, not discomfort. It's not a miracle, it's biology remembering its harmony. Sometimes healing isn't about adding something new, it's about reminding your body what it already knew. In 1993, a groundbreaking study in the New England Journal of Medicine changed everything. Researchers gave postmenopausal women with constant bladder infections a simple vaginal estriol cream. The results were jaw-dropping. Infections dropped by more than 75%. No antibiotics, no drastic measures, just the body restored. The estrogen didn't just soothe the surface, it healed the root, rebuilding tissue, restoring bacteria, rebalancing chemistry. It reminded the body how to protect itself, just as it had done effortlessly for decades. Let's talk about something most women whisper about: pleasure. When tissue becomes thin, dry, and fragile, intimacy stops being intimate. It becomes something you dread, something that hurts. And that pain doesn't just live in your body, it creeps into your confidence. But as the tissue heals, connection returns. A Cochrane review, 2020, found that vaginal estrogen restores comfort and elasticity far better than lubricants or moisturizers. One woman from that study said, "It wasn't just that it stopped hurting, it was that I felt like myself again." That's what this therapy gives you. Not youth, but freedom. Pleasure isn't indulgence, it's a sign your body feels safe again. Here's something most women don't realize. The same estrogen receptors that live in your vagina also line your urethra and bladder. When estrogen disappears, those tissues weaken too. That's why you may suddenly feel like you have to rush to the bathroom more often, or why you burn after urinating even without an infection. When you restore estrogen locally, the tissue firms again. The urethra closes more completely. The inflammation that made every trip to the bathroom sting begins to disappear. The American Urological Association now recommends vaginal estrogen for women struggling with these bladder symptoms, not only to relieve discomfort, but to prevent infections altogether. Not every bladder problem is a bladder problem. Sometimes it's estrogen calling for attention. Every woman's story is different, and so is her healing. There isn't one perfect product, only what feels natural in your rhythm of life. For some women, it begins with a soft cream, a silky formula that you apply yourself. It's soothing from the very first touch. You can adjust the amount depending on how your body feels. It's perfect if you have irritation at the opening or around the vulva, because it coats the tissue directly. Many women say that first sigh of relief feels like their body exhaling for the first time in years. Others prefer a tiny tablet, smaller than your fingertip. You place it inside, it dissolves slowly, and it just works quietly and cleanly. It's for the woman who wants simplicity, who doesn't want to think about it every day, but still wants results. And for others, there's the vaginal ring, a small, flexible circle that releases estrogen little by little over 3 months. You place it once and simply move on with life. It's invisible, effortless, and constant, like a heartbeat you don't have to manage. No matter which one you choose, they all have the same goal: to bring back comfort, moisture, and confidence gradually, gently, and sustainably. Most women start daily for 2 weeks, then continue a few times a week as maintenance. It's not a race. It's a rhythm. One your body remembers perfectly. The right choice isn't about convenience. It's about harmony and finding the way your body says yes again. Here's what many women fear. Is it safe? The truth is, low-dose vaginal estrogen stays local. It doesn't significantly raise estrogen in your bloodstream. The North American Menopause Society and the American College of Obstetricians and Gynecologists both confirm it's safe and effective for most women, even for long-term use. Even women with a history of estrogen-sensitive breast cancer may, under medical supervision, use it safely, according to new research. Safety isn't about avoiding risk. It's about finding the balance that honors your story and your needs. The beauty of this therapy isn't just in what it does, it's in how it unfolds. By week 2, you might notice that burning sensation beginning to fade. Simple things, sitting, walking, intimacy, start to feel normal again. By week 6, moisture returns naturally. You feel softer, calmer, more at ease in your own skin. And by month 3, many women notice that bladder infections simply stop coming back. You're not just managing symptoms anymore, you're living without them. A 2020 meta-analysis found that over 80% of women who stayed consistent with vaginal estrogen reported lasting comfort, improved intimacy, and restored confidence. Real healing doesn't announce itself, it returns quietly, one comfortable day at a time. Let's move from what you feel inside to what you see in the mirror, that soft radiance, that glow that once seemed effortless. Here's something few women realize. Your skin is an estrogen organ too. Just like your reproductive tissues, your skin is covered in tiny estrogen receptors. When estrogen binds to them, something extraordinary happens inside your cells. Collagen starts to rebuild, those invisible fibers that hold your skin firm and smooth. Elastin returns, restoring flexibility and resilience. And hyaluronic acid, nature's own moisturizer, rises again, locking in hydration drop by drop like morning dew resting on petals. Estrogen doesn't stop there. It strengthens your skin's antioxidant defenses, guards against free radicals, and even boosts circulation, so your cheeks regain that subtle warmth no highlighter can mimic. In 2021, JAMA Dermatology published a remarkable study. Women who used low-dose topical estrogen, formulations with estriol or estradiol, developed firmer, thicker, and more hydrated skin within just 3 months. And here's the surprising part. Their blood hormone levels stayed within safe limits. The treatment acted locally, nourishing the skin exactly where it was applied. Since then, researchers have started exploring something fascinating, whether vaginal estrogen creams, which use the same mild forms of estrogen, could offer similar skin benefits when used on the face. Early laboratory findings suggest that the skin may respond in comparable ways, stimulating collagen growth by up to 30% and increasing hydration retention by over 20%. It's not an approved use yet, but science is paying attention. Some dermatologists call this the next frontier in menopausal skincare, a bridge between hormone health and visible vitality. It's not about vanity, it's about biology, about remembering that your glow isn't lost. It's simply waiting for balance to return. The best first step is simple. Talk to your doctor. Describe what's happening, the dryness, the discomfort, the bladder issues, the shift in how you feel about yourself. Together, you can choose the form that fits your life. You'll start small, see how your body responds, and adjust from there. And remember, the real magic isn't in the product alone. It's in pairing it with gentle movement, hydration, sunlight, and rest. Those are the moments your body uses to rebuild itself. Every small act of care is an act of rebellion against silence, against shame, against the idea that you should simply put up with it. There's something deeper here, because what this journey really gives back isn't just comfort, it's identity. It's the quiet confidence of walking without wincing. It's the joy of closeness without fear. It's realizing that your body was never broken. It was just asking for compassion. You deserve that peace. You deserve science that serves you, not dismisses you. Healing your body isn't the end of your story, it's how you come home to yourself. If this message made you pause, if you felt seen or simply hopeful again, hold on to that feeling. It's your body remembering balance. Join us at the Midlife Balance Institute, where modern science meets ancient self-trust, and where women don't just survive menopause, they thrive through it. Click like if this video gave you a moment of calm or clarity. Click subscribe if you're ready to turn proven research into everyday rituals and make midlife your most radiant chapter yet. And stay tuned. Our next video dives deep into the hormone that balances estrogen, progesterone. We'll explore how it shapes your sleep, mood, and metabolism, and what happens when it starts to fade. All the scientific sources mentioned here are in the video description below, so you can read them yourself and feel empowered by evidence, not overwhelmed by fear. Because balance isn't found by chance, it's built, one breath, one choice, one heartbeat at a time.